in. Do we want to start with some introductions? I'm also going to preface this too with if I just my camera position as we're all adjusting to working virtually and doing these I'm navigating virtual spaces. I'm going to admit that my webcam is actually at the bottom of my screen. So if I'm looking really pensive or if I'm looking like I'm staring off into space, it's just because I have a unusually placed webcam. So also if you might see me take notes, and these aren't spiders, these are just my fingers too. All right. Well, let's kick off with some introductions from folks today. And so we'd love to know a bit more about who's here in the virtual room with us, joining us for finding and using data to tell stories today. So if you're able to, please in the chat box, enter your name, your pronouns, an organization that you may with if you are with one. And then we thought it'd be fun just to get a poll of the room too, an idea. So we have a fun question here around knowing that unfortunately the 2020 Summer Olympics were canceled this year. We'd still like to know if you competed in the Summer Olympics, what sport would you choose to participate in? All right, we're seeing some responses. Thank you all. Personally, when I was asked this question, I said that I would be interested in, I would love to compete in sit volleyball, which is actually a sport in the Paralympic Games. But if you've never seen it before, I'd encourage you to YouTube it and check it out. I had the opportunity to attend the Paralympics in Rio when I was cheering on my cousin, who's a wheelchair athlete there. But I got to see, I think it's one of the tallest people in the world to get to compete in sit volleyball. So that was a really cool experience. Sarah J. or Honey, which sports would you like to participate in?
Yeah, I've played basketball for most of my life, so I think I would probably do basketball just to stick to what I know. What about you, Sarah J?
Hi everyone, Sarah J, she, her pronouns, with Best Arts for Kids at the Health Department, and not an athlete at all, but I would go with trampolining because it's fun, and it's not very clear to me how they compete, but I know I can jump on a trampoline, so.
Awesome, awesome. Yeah, I've seen a lot of soccer here. We got some gymnastics fans, summer swimming. Great, great. All right, but yeah, some introductions in the chat are really helpful for us. And then again, I'm Mariko Toyoji, she, her pronouns, and I'm an epidemiologist with Public Health Seattle King County and Communities Count.
Just a friendly reminder, if we can have folks just mute themselves for the purposes of the presentation. And if you do have any questions, feel free to ask those questions either through audio or through the chat box. Anything that comes up in audio, we will be editing that out, but feel free to utilize the chat box throughout the workshop today to ask your questions and to engage. Thank you.
All right, great, great. We've got a lot of folks here today. This is exciting.
Yeah, so it is.
I think we could field the soccer team.
Yeah,
that's what the people here today.
It's a lot of soccer.
Ooh, archery, yeah. All right, great. Well, thank you all for introducing yourself virtually, and we're really excited also with the number of folks here, and then also the expertise in the room too as well. And so we encourage you all today as we're meeting and we're learning together. As you have questions or if you want to contribute to using the chat box, and we're all going to be monitoring that today. And so we're all practicing kind of different ways of engaging together, and so we're going to use this way as well, knowing how many folks that we have in the room today. Yes, and being in the stands counts too. So
Absolutely.
excellent. All right. Well, I think
Excuse me. Hello,
yeah.
it's Janet. I'm trying to connect on the computer. Could you tell me the password for this meeting? Is there a password?
I don't think
It's
there should
asking me
be.
for a password on the
Yeah, there
computer.
shouldn't be. Let me.
Did anybody else get asked for a password when they joined?
813670. 813670 is the password.
Thank you.
Got it. Thanks.
Thanks, Roel.
Thank you.
Thank you. All right. So today we're going to transition over, and we wanted to start off our workshop today with a land acknowledgement. And we gather today on the ancestral land of the first people of Seattle, the Duwamish people. We honor with gratitude the land itself and the Duwamish tribe and all of the Native people who call King County home. And so this acknowledgement is one small step against the erasure of our Native communities. And in addition to the Duwamish, King County is also home to the traditional lands of the Muckleshoot, Snoqualmie, and Tulalip tribes and other Coast Salish people. And today, King County continues to be a home to a vibrant and diverse community of Indigenous people from across North America and beyond. So if also too, if you have questions about the land acknowledgement or want to see some other resources, in our slides, we'll also have some links available too. And so we're gonna, next slide, please. We're going to get started today with just kind of an introduction and map of where we're headed. And so really, this is what we'll cover today. And what we're really hoping that you all get out of our time together are some tools and frameworks for using data and stories to highlight your organization or community strengths and really to help you meet your goals. This is one of a series of data and evaluation capacity building workshops that Communities Count in partnership with COO and BSK is offering. And really it's to equip attendees with skills to leverage data and evaluation to further local equity work and then also to help meet organizational and community goals. As I've said before, we really want to acknowledge and encourage folks to participate and also knowing and seeing the expertise in this virtual space today. We're really encouraging this to be a group learning opportunity, and we want everybody to learn from the expertise in the rooms, ourselves included. So please do share your knowledge and ask questions. It's really to the benefit of everyone here in the space today. And we'll have the chat box monitored, so feel free to chime in as you'd like during the presentation. So next slide, please. All right, so why data storytelling? This quote sums it up pretty well, but it's a powerful combination. It isn't the only way to present data, and it may have some limitations as well, but it's one framework for really getting an impactful message across to your audience. And so we just wanted to check in today and learn a little bit about why folks are interested and what may have brought you here today. If you want to enter into the chat box, we can take a look at those and see some of the interests that we have here.
Hi everyone, my name is Roweda from the Somali Health Board. I'm a home visitor, so I joined the storytelling with the data because I feel that it's really important with the work that I do. Every family is different, every situation is different, so I feel like the storytelling skill could really help me
Yeah,
collect a better data
let me see. Can you see me? Okay, yeah.
and just be able to tell everyone's story.
Okay.
Great, thank you. I'm seeing here in the chat box another another person, Kayla, said that they want to make sure that they capture the use story genuinely, and that's also really great too.
Yeah,
And
Gloria
then,
shared, I want to understand why my data entry is important and gain knowledge and respect for the aspect of my work. That's great, Gloria. Thank you for sharing that. Bonnie, thank you. I want to learn about your strategies and efforts in storytelling with data as an evaluator. Thank you for sharing.
Hi, I'm Tan Kirkpatrick, Director of BFAB, Vietnamese Family Autism Advisory Board. And I think the data, I really like this quote, so thank you for showing it. The data tells you what's happening. So this is like the evidence, the background, but the stories are what's compelling that actually moves people to kind of understand and almost try to empathize with your cause.
yeah, exactly. That's really well put, Tan. Thank
Mm.
you. And so, next slide, please. That's actually a really great transition into why we're really emphasizing storytelling with data today. And you may have heard of the left brain divide, which isn't super scientifically accurate. We use all parts of our brain a lot. But what is true is that people process information in different ways. So some folks might be more attuned to numbers, other might be more drawn to emotionally powerful stories. And so when you communicate in a way that combines data with an emotionally rich story, you're appealing to lots of people in many ways and really expanding kind of the draw to your audience as much as possible. And so no matter how people process information, a data story can really appeal to a wide variety of folks. And so, yeah, I'm seeing other comments here too around centering data around community, and that's also really important. And so one of the things that we'll have an opportunity to practice today as well in some of our breakout activities. And so as we're thinking about what's a story, we wanted to start really simple. So we wanted to start by identifying the goal. So what is that one key message that you want your audience to hear, and really centering around that? Or perhaps you're looking at data and you found a really interesting finding, and you want to understand what kind of context or other information will help make that piece of information more compelling or provide the appropriate context for it. And so the next step after you've identified kind of that key message or that key piece of data is to gather up and figure out what other information will make that story or that point convincing. And so some questions you may want to ask yourself is if you need to find data to connect, or if you need some more information or context around the data to move towards your goal. And then the last kind of step in this really simple framework is to put it all together. So find the information, find the data you need, and really pair it in a way that creates a cohesive and compelling story. We encourage folks to either kind of walk through a process like this with outlines. Simple is really better. Keeping it pretty straightforward to 1 or 3 data points is a best practice. But we wanted to start today, and we'll go into more detail as we talk today about other frameworks and strategies too. Next slide, please. So we're going to start off with what are data? So numbers are perhaps what we most are likely to think about as data, but there's many sources of quantitative data out there, which will provide some resources later on today in the presentation. But yeah, I think this is an example of a graph of bar chart of some population data from what's called the Healthy Youth Survey. It's a data set that we use often locally, and it's a survey of public health, or sorry, of public school students around many kind of aspects of health and health behavior that is done every other year. And so we encourage you to check it out. We'll have some links to it later on, but you may, this is one type of data, but you may already have some numbers that your organization has created or that your community has also collected. And so you can find them out there that help describe program you work with or issues that you're engaged with right now. And so we're going to be talking today a lot about population level data in our examples, because honestly, that's the data that we know best here, but we also want to acknowledge that you all may have data and that also other numbers can be really an important part of a powerful story. And so community and program data are another great kind of data source to think about. And that the most important part is to use data that helps you meet your goals. Next slide, please. And then I'm hearing a little bit of feedback. Just as a quick reminder for folks to mute their mics, please. Yeah, we're hearing some pretty loud kind of background noise. Okay, great. Thank you so much. So another type of data are maps. Maps are really important and compelling, especially if we're talking about a specific geographic area, possibly using a map to show that there's a need or an inequity that's being experienced in a certain area. And you can also get creative and do things like show maps where your services are or other assets in the community too. Next slide, please. Another type of data that I don't think everyone thinks about immediately, but images. Numbers and words are the only way to share information, and images are another powerful way to convey impact or an issue that you're engaged with, and that can also be a key part of a compelling story. So some say a picture's worth 1,000 words, and we absolutely agree. And so one thing to note is that if you are using a participant image, like from one of your programs or something, you should do so with their permission. And so it's always just the best practice to check in with folks and make sure that you have that permission to use an image and in any kind of storytelling or information product, that communication product that you're putting out there. Next slide, please. And another type of data that is really important are quotes and stories. And so stories directly from people are also data. So sometimes in kind of our evaluator toolkit, we'll call this an example that we're presenting here is based on a story that a parent shared about how a program helped them. And if you take a few moments to read through it, you can probably tell that we took out some of the specific details about the family and the program, but you can imagine that a story related to your work or your own community would be even more impactful with those details. And so again, that while this aren't specifics in this quote, we found that it was important to remove those. It still conveys an important message and an important lived experience that we think would really enhance and also center people and community in a data storytelling. So really thinking about these different types of data and how they can complement each other is a key part of data storytelling. And then as with images, if you're using participant words, again, you should do so with permission, even if you are, and then always take out identifying information as well. And another part about storytelling and data and equity is that data is often used for policy making, grant writing, and program design, but also so much more. But really also too, like we think strongly that data should be used to advance equity and well-being. And so really that data can be used also and has a history that sometimes that it can be used to perpetuate inequities. And so we also want to point that this can be, but it's also preventable as well. And that we think that data storytelling is an important part of providing the right context around data to tell an equitable, well-rounded story that really provides that important context too. And so we're going to transition next away from data and then over back to centering on stories.
Hi, everyone. Thanks, Marco, for that great start. I know that some of you have been participating, hopefully, in multiple great sessions as part of the Best Starts for Kids Summit in collecting your secret code words that Carrie has organized. So if you are waiting for your code word, it is radio. And Mariko, if you could type that to the chat box just so everybody can refer to it. Our code word for this session is radio. So with that, we're going to talk a little bit more. We started with what can be data. We're going to talk a little bit more about what makes a story and then move forward in some different activities to put them all together. So we're sharing a few different frameworks today, and I just want to be really clear that there's no single right way to approach data storytelling. But oftentimes we find having a framework can help get the creative juices flowing and just be easier than starting from scratch or maybe even not knowing where to start. So we'll continue putting some of those frameworks out there. Hopefully they're helpful, but the idea is to provide a starting point, not to say this is the way to think about it. So what makes a story? We see here, this is a photograph from a Communities of Opportunity, which is part of Best Starts for Kids that does a lot of community organizing work, gathering that they had. And when I look at this photo, I see that the speaker really is holding like rapt attention from the audience that they're speaking to here. So what kind of story has that grip and really can help you engage your audiences like these folks look to be engaged? We like to think about three basic parts to a story. And this is also where data storytelling sometimes comes in. One part is the head, getting your audience to think. Sometimes the numbers are a good thing to think about plugging into that head, but it's not the only part or the most important part. The other part is heart or feel. This is sometimes where things like images and words and quotes can really help round out that story with an appeal to the values or the emotions of your audience. And finally, as Marco said, when we start with the goal, how are we acting on this information? So how are we using data storytelling to promote equity and well-being in our communities? It's a simple framework, but if you are working on something, at least I find this really helpful. When I'm working on something, sometimes I stop for a moment and I think, what am I doing in this story to engage the head, engage the heart, and engage the hands in action? And it'll help build a well-rounded product. So again, as Marco outlined, and as we mentioned with ACT, how do we embed our equity values in our storytelling? These are some values that Best Starts for Kids has developed for our Best Starts for Kids related storytelling. And I'll take a few minutes to go through, but again, this is just one framework. And I would love to hear, let's see, I'll take a moment to read through some of this, but if you can enter into the chat box or in a moment unmute yourself and share what has helped you ensure that equity values are embedded in your storytelling. We'd love to share just the group expertise around this as well. So a few considerations that Best Starts for Kids has outlined include personalizing.
I was just trying to see if I could get one of your value packs with 4 steaks instead.
Don't make it anonymous. Don't make it generic. Make it human. Ask someone how they want their story shared. So if you're sharing a story about a community or about individual community members, making sure that they have the opportunity to control how it's going to be told. And not just saying, you know, hey, is this okay with you? But thinking of the power dynamic, especially if it's somebody who might be receiving services or funding from you, and making sure that they feel empowered to actually be a decider in how their story is told. Be a partner, not a savior. So sometimes, you know, we have a history in social services, both government and on the nonprofit side. We have a history of communicating ourselves as kind of the hero in the stories that we've told about our work sometimes. So thinking about actually centering the community members' own role and own resilience instead of centering ourselves as service providers in our stories. Ensuring others can see themselves in the story. So breaking down stereotypes by showing an authentic and a genuine experience that people can relate to. And challenge the myths. So think about what might be a new angle, a surprising perspective to add to the issue so that people don't just fall back on their old mental models or on stereotypes, but instead have an opportunity to think about it a new way. So with that, I'm going to kind of pause my chatting for a moment, and I would love to hear in the chat box, or if you'd like to unmute yourself, some of what has helped you embed your equity values in storytelling. Okay, nobody wants to chime in. That's totally fine. I'm going to go ahead and move forward. So some logistical things. Oh, I see somebody did pop in the chat box. Calling out what makes our client population unique. Absolutely. Thanks for that, Erin. Yeah, we have so many amazing communities in King County, and they all are unique. So thinking through some logistics about your story can help as well when you decide what is going to be included and what's the kind of format that you're going to offer. One thing that's important to think about is your audience. And you may have more than one. Sometimes you got to make one product or one story that's going to work for several audiences. So community members, often that's who we feel most genuinely accountable to, who we're serving. But there's other folks as well. We can use the media to tell our stories. Decision makers, such as policymakers, funders, and our own internal staff, especially if you're using data to plan or improve programs that you might offer. For example, internal staff can be a really important audience as well. So thinking through, who do I really want to reach with this story? What kind of information is going to be compelling and impactful for them? And then what's the medium that's going to work for them? Where are they? The first time we did this workshop, we were actually able to all be in a room together. That feels like ages ago now, to me at least. So we're all thinking a lot more about digital mediums these days, and fortunately they provide great opportunities to access audiences and be creative. So is this story going to be something that you share on social media, share on your organization's website? Is it going to be a written story? Will it be a video? Will it be images like an infographic? Or will it be a presentation that could be shared in a webinar like the one we're having now? I just want to call out a couple more things that I'm seeing in the chat box. Thank you so much to everyone who's contributing. Ask who is benefiting from this data. That is a great question. to always be aware of. And that goes into not just how you're telling your story, but how you're gathering your data as well. And memory shared barriers and challenges experienced on a regular basis. So we're going to do a little activity now. We have some example data that we're going to start with, and we'll take a moment just to talk it through. And as we look at this data, what we're going to do is ask you to think about like how would you communicate this data in something really short, like a t-shirt slogan or a bumper sticker. So what we're looking at now is a graph that shows e-cigarette use, often called vaping, among 8th, 10th, and 12th graders in King County, and how that's changed over time. So this data is collected every 2 years, and we see it every 2 years from 2012 through 2018. The purple line at the top shows the rates for 10th graders. And so just eyeballing this, I see that the most recent data in 2018 looks like about 24 to 25% of 12th graders had said that they had vaped. This orange line in the middle is 10th graders. And to me, this looks a little bit lower, closer to 16 or 17% in the most recent year. And then finally, this yellow line shows 8th graders, this line at the bottom. And they have the lowest amount, between 7 or 8% in 2018. So that's the data that we're looking at. This includes students in public schools of all genders, all races and ethnicities, and all the different school districts across King County. So we're gonna share a t-shirt in the next slide that you can add your slogan to. But before we do that, are there any questions about like what are the data that we are looking at here? You can put them in the chat box or unmute yourself. All right, I'm gonna move on to the next slide so we can hear your ideas, but if questions do come up, please feel free to ask them in the chat box or again by unmuting yourself. So we have here a t-shirt. If you go to the top of your Zoom window, you should see something, sometimes it's under a menu called View Options, and you can annotate. So if you would like to try and get a little fancy on Zoom with us, you can go to that annotate marker and you can either write, yay, we get some annotations. You can write freehand or you can write in some text about what you would write as a t-shirt slogan. So if you'd like to try that, we'd love to see your thoughts. And if you feel more comfortable just speaking up verbally or typing into the chat box, we'd love to hear from you that way as well. I love that folks are decorating. This is so fun to see for me. It looks like Bonnie has added in the chat, by the end of high school, 1 in 4 students has tried vaping. Vaping on the rise. If you are a more artistic person, you just want to decorate the t-shirt, feel free to do that as well. I love the creativity I'm seeing here. Liz is asking, where do I go? Yep, vaping is on the rise. If you are trying to do some annotations, usually I find it in the top of my Zoom window. So sometimes if you go to the top, if you're in full screen, there's some items that will come down like participants or things like that. And there might be a little pencil that says annotate. Sometimes if you click on view options, you'll see annotate there as well. If that's not working for you, just feel free to type it in or unmute yourself and speak up. Stop the vape before grade 8. In just 4 years, vaping increased over 300%. Escape the vape. Whoa. Oh, a sad face is forming. Vaping happens. Talk to your kids today. Vaping use among teens is on a steady rise. Talk now. Vaping on the rise. Whoa, no more vapes. Be smart, don't start. Stop and love your lungs. Vaping will kill you. Next time I need a t-shirt motto, I'm gonna just ask you all to come up with it for me.
These are great. I love the process I'm seeing too, where folks are kind of building on each other's stuff. And yeah, I think this is a really, really fun exercise.
All right, I still see some drawing happen, so I'm gonna give it a couple more minutes. If you want to get something in, now is the time.
Unfortunately, there isn't a BSK t-shirt shop, but maybe next year.
Breathe healthily, live happily. Yay, BSK. I know we should tell our colleagues in the tobacco program at the health department about this activity too. They might have to follow up with you guys and see if they can use your ideas. Christina asked, 2 years of reduced vaping among teens. What happened? Yeah, why did we bounce back up so high again?
Yeah, that would also be a really good, interesting part of a data story. Is that why?
Yeah, this is definitely an example to me of the numbers telling what, and it brings up a lot of why questions for me. CK rocks. Whoever you are out there, CK, you're rocking. Yeah, Jewel, marketing towards young people. All right, well, thanks everybody. I really enjoyed that. I hope it got some of your creative juices flowing. We really appreciate hearing everybody's ideas. Okay, now let's see. Let's see if we can clear the annotations. All right, there we go. We have a section for you. One thing that we could kind of go through quickly or spend a little bit more time in depth on, that's just about sources for finding local data. So I'm gonna ask everybody, feel free again, if you're more comfortable, to chime in the chat or by speaking up, but we thought an easy way to get a little head count of how much interest there is in this would be that if you just want to do that thumbs up reaction, if you're really interested in digging in to where to find local data, so we can see that. And if you are like, I can check out the slides and click the links later, we'll go through it a little bit more quickly. So feel free to put in that thumbs up if you would like us to do a little bit more in-depth version of this. And I'm gonna hand it over to Honey to walk us through this section.
Great. Yeah, I would love to hear folks' reactions to that. I can go through this briefly. There's a lot of links available within the slides that we will be sharing and that will be available. So yes, I'm seeing a lot of later, a lot of briefly. So I'll definitely I'll make this brief. And like I said, these slides will be available for folks for viewing later on. Again, my name is Hani Mohammed, and I am a project program manager on the Communities Count team here in Public Health Seattle King County. So just real briefly, there's a lot of data available out there, and I'll go through some examples to help you all maybe just figure out some of where that data is and just to familiarize yourselves with it a little bit more. A great place to start is the Communities Count website. And as you can see from the slides, there's an array of topics that you can find that are both impacting families and communities here in King County. But really data storytelling is all about telling your own story. We're just going to be sharing a few examples of where that data is available, not because we think it's the best data or the only data, but it'll just be a few examples for you to just get started. One helpful topic here on this specific site is the populations tab. So if you ever visit the website and you click on the population tab, you'll see that you can look at race, you can look at age, employment, foreign born, you can look at poverty levels, and many more census focused information, as well as information about cities and specific neighborhoods. So this is a great place to start for sure. Next slide, please. Oh, yeah, sure. One second. Is that better? I'm gonna thumbs up. Is that okay? Can you all hear me okay? Cool, thank you. Okay. So this next slide here is King County specific, again, data. This is the city health profiles, which is a really great resource if your program serves a very specific geographic area in King County. They include some demographic information as well as key health information for cities, both big and small. So I would definitely start here, especially if you're looking for specific key health indicators. This is a great place to start. Next slide. So these are again, this is the BSK dashboard, or BSK indicators dashboard for those of you that may or may not be familiar with this. It's where you can find information about health and well-being topics that BSK is either working towards with their community partners. These indicators help BSK to really better understand and inform BSK initiatives and other community efforts that are contributing to population level health improvements and really overall well-being. These are the big goals that BSK is working on, and the dashboard is a great place to find some of that information, whether it be about health, whether it be about well-being, or maybe some of the disparities. Because we have information from a lot of different data resources, what's available will vary sometimes, and it's usually a case by case. One of the sources is the Best Starts for Kids Health survey, which includes over 6,000 diverse families here in King County, of course, who participated in it last year. And you can search among the indicators and really sort them out depending on the specific area or the indicator that you're looking for. And again, if folks could please mute themselves, we're getting some background noises. So if you can just make sure that you are muted throughout the rest of this conversation, that would be great, please. Next slide. And again, there's many resources for King County data. Here is just a few more that might be helpful. The first one here is the community health indicators, which focus on specific health behaviors here for residents in King County. The Office of the Superintendent of Public Instructions, you'll find the Healthy Youth Survey, and profile reports provide information about key student health indicators and their determinants as well. And then if you're looking maybe for school district information and school district health profiles, you can find things like graduation rates, amongst other sources of data as well. Next slide. We wanted to provide you all again, not only data around health and health indicators, but also local and civic data, just to get a better understanding, because as you know, government is big, sources of information, there's a lot of that. So just making sure that if you're interested in familiarizing yourself maybe with budgets and staffing, maybe some of its activities such as permitting and boundaries, and the data it gathers about the environment and community. And this is, again, a really great data resource to start. We go into from state level to county, and we only have a couple cities listed here, but of course, most major, both small and big cities do have data portals, and a lot of them can easily be found by data.the specific city you're looking for .gov. So there's definitely lots of data available. Sometimes it just requires you reaching out to said agency or organization to ask for that data. I was doing some work in the Somali community regarding vaccines and immunization. So reached out to some folks at Department of Health to get some specific data because I couldn't find the data. So sometimes it does require some digging and some research, and to make sure that you are reaching out to folks in said agency or said organization to request the data, because sometimes the data is and can be requested. Next slide, please. And again, while we're making lots of data available, you might not find the information specific to the cultural or racial or ethnic groups that you are serving, or that whose needs you are wanting to address. So here are some ideas just to get you started. And it's really thinking about your issue or your topic that you're trying to address and that you're trying to discuss. Is there a national organization or group that's dedicated to this work, and they might have helpful data available for you. For example, the Urban Indian Health Institute publishes reports about the health and well-being of Alaskan Native American Indian people here in our major cities. We don't have a lot of data on trans students, but there are national organizations that do. Is there a local community organization that might share some of that specific data or that community? So two examples are the Interim Community Health Action and the White Center Community Development Association are just a few of those local examples, as well as the Transgender Economic Empowerment Coalition and the Snoqualmie Valley Supportive Community, for all examples, for just some of the CEO partners and the specific data that they collect. Next slide. And again, just thinking about when it comes to getting a little bit more creative, it's really thinking about what data do you already have, right? So participant quotes, images, and videos, those are considered data. Stories, and some of the stories and the conversations that you're having with your community highlight some of those needs and what those strengths are. That is data. Program data from past relevant work. So thinking about specific projects that your organization might have already completed and some of the data that was collected during that is considered data. Number of folks who are engaging in a specific program, thinking about your leadership, that structure, thinking about your reach, how many folks were impacted or benefited from said program, that is all data. So just to keep that in mind when you are thinking about data resources. Sometimes it is just doing some homework in-house and figuring out what data do you already have access to. Next slide. Now I wanted to go a little bit even more specific and provide an example of a storytelling with data. This is an image of a bus ad created by COO Partners Feast, which is a youth-led healthy food campaign. The red marks represent locations of fast food restaurants near two high schools here in King County, both Chief South and Evergreen. This is a really great story that invites the readers to really address and understand the compelling question and shows a clear pattern in food that's available to young folks here in our community. So as you can see here, the person in the image is looking a little sad, a little disappointed in some of the food access that we have. So the red marks indicate fast food restaurants. And then of course, you can see where the high schools are located, and you can see all of the red marks surrounding the high schools, which represent all of the, again, the fast food restaurants that are available near those schools, and the lack of more healthier options for our students. Next slide. And this last example is of the community voice listening project and some of the data that was collected. So for Healthier Here, which is the accountable community of health here in King County, did a listening project with about, I believe, 18 different organizations. And my numbers might be a little off. I participated in this project a year or two ago. So about 18 different community-based organizations and over 500 participants with 22 languages that were that this survey was provided in. And really the goal was to ensure that Healthier Here's efforts to improve the healthcare system are really guided and influenced by the communities that are being served, and aiming to develop an ongoing meaningful mechanisms to ensure that those community voices really do drive the work. So as you can see here, the question is ways to improve patient satisfaction with care. And a lot of folks overwhelmingly said that having clinics stay open late and weekends, that was really the overwhelming response during this for this specific question. Of course, another one, having someone who speaks the language at the clinic. Although a lot of clinics might have interpreting services available, sometimes it's just not readily available for folks. And of course, having medication delivered to home are the top three most selected choices for this. So the last two were just examples of some community data storytelling, and of course there's a lot more, but just wanted to go through this briefly just to give you all an idea of what that all looks like. And again, these slides will be shared, so some of the links and the information that I discussed are going to be available for everyone. So thank you, and I believe I'm turning it back to Sarah J. Sarah, we can't hear you. It's still muted.
Thank you, hon. All right, so we're going to do another group activity in a few minutes where we're actually going to break up into Zoom rooms with small groups. And before we dig into that, we wanted to just offer another framework around data storytelling. And again, this is not, lots of great data stories might not fit into one of these types, but it's just a starting point and something that might help think through what kinds of stories you might find in your data. So I think, Mariko, if we could drop in the chat, there's a handout that you can reference that has more information about some of these stories. But we're just going to go through some different examples of different types of stories that can commonly be found in data. So we'll look at a factoid story, just looking at one data point. Why does it stand out? Interaction story, so looking at a couple different pieces of data and why do aspects of these data change with each other. Comparison stories, so what's meaningful about the difference between two different data points. Change stories, oftentimes that's change over time. What made this piece of data change from this to that? And then personal stories, how does this data connect to a real person's real life? So again, lots of great stories might not fit into these specific types, but it can help to have a starting point, especially if you're starting with just looking at data and trying to find a story in a bunch of data. Having some different possibilities in mind may help you sift through it a little bit. So we'll start with an example of a factoid story. This is from the Best Starts for Kids Health Survey. And we found that 3 in 4 parents say that they do have somebody to turn to for day-to-day emotional support with raising children. And I'm curious if anybody would like to unmute themselves and speak up or share in the chat box just what stands out to this about this piece of data to you. Do you think that it's maybe more than you would have thought? Is it less than you would have thought? Is this something that might change now that we're all living in much more isolated ways during the pandemic? It's just a factoid. So I'm curious, yeah, if this is standing out, if this is interesting or notable to anybody. Heather shared in the chat, strange they're not highlighting that 1 in 4 parents do not have someone. Yeah, that's a great point, and that I think that speaks really powerfully to the power that you have in framing when you tell a data story. So if you thinking about whether you want to highlight the need that's there, it could be a lot more powerful to say 1 in 4 parents doesn't have somebody to turn to for that support. Erin says ditto. How would it be heard by a funder audience? And does it make it seem like lack of support is not an issue? And who are the people that parents do turn to? Who are these 3 and 4 parents getting that support from? Tan says it's actually more. Who did ask ethnic background? Tan or anybody else that wants to, you can find out a lot more details about who took the survey and how they said in different racial ethnic groups, language groups, geographic groups, all on the Best Starts for Kids indicators that Mari Coach shared in the chat if you would like to find out more. So it seems like there's a bit of a consensus emerging in the chat that people think it'd be actually more powerful to focus on the 1 in 4 that does not have support. So that's an example of a factoid. You can see even though there's just one fact, it brought up a lot of different questions and ideas about like, how would this be framed for different audiences? How would it speak to a funder? Would we focus on the 3 that have support or the 1 that doesn't? So the next type of story that I want to look at is an interaction story. So this is from a Best Starts for Kids funded strategy that many of our community partners have been implementing called Kaleidoscope Play and Learn. And this is community events where parents, family, friends, and neighbors that are caregiving for children in their community can get together and they do developmentally supportive activities for little ones, basically toddlers. So among these participants, 80% said that they had a better understanding of their role in the child's kindergarten readiness. Similarly, 80% said that they spent more time reading, looking at books, and telling stories with the children that they care for. And even more, 88% said that they felt more supported by their community. So when I look at the 3 different things here, I wonder, how could these be interacting with each other? And again, I would love to hear thoughts if anybody would like to chime in on the chat box or by speaking up. You know, when I look at these, it makes me wonder, like, does the second and first thing or the second and third thing go hand in hand? Maybe if caregivers understand better their role in preparing their toddler for kindergarten, they might spend more time doing that reading together. Or maybe if they felt more supported by the community, that helps them spend more time reading together. And this is also an example of like, how would you maybe fill out this story with a quote or a story from a parent who participates in what this participation has meant for them? I see some questions in the chat. Why isn't the support reflective in the readiness? What was the goal of taking the survey to get the 80%? Was it to find out how workable a project was or not? Yeah, so across the different, how much participation? That's a great question. I actually don't know the answer to, of how frequently parents and caregivers participated who took the survey. But it's basically to understand how is the Kaleidoscope Play and Learn program impacting participants. All right, I want to get us along to the group activity. So we'll go through a couple more examples. Here we have a comparison story. And what we're looking at is a map of data from the American Community Survey that shows what percent of households in different parts of King County are living at least 200% or 2 times the federal poverty level. So overall in King County, 80% of households, representing about 1.7 million people, are living at least 200% of the federal poverty level. And there's definitely limitations to that cutoff. We know that 200% of the federal poverty level still may not be a living income for a household. But that is what we're looking at here. So we see that overall it's 80%. Demographics too, yes, you can find the demographics in the interactive version of this on the website. But for right now, we can just look at the map that we're all seeing together in the slides. There's a huge variation. So this dark blue area that I'm seeing just east of Lake Sammamish looks like they have 95% of households are at least 200% of the federal poverty level. Whereas when we look at parts of Southeast Seattle, Southeast King County, it's only about 58 to 59%. So we see a huge geographic variation in how many households are meeting that income threshold. If we look at other maps of health and well-being and socioeconomic data for King County, we would see some similar patterns across them as well. So oftentimes this comparison story can really illustrate an equity or inequity story. I'm curious what folks see when they look at this contrast. What's a story that you might tell based on seeing the variation that we have in income across King County? All right, I'm going to move on to our second to last example, which is a change story. So the Best Starts for Kids Health Survey, we reached out to parents to participate from kids aged about 6 months through 5th grade. So we could look at the data for toddlers and infants and those kids that had started elementary school. And we asked a set of age-appropriate questions, depending on the age of the child, for a definition of what's flourishing. And this includes things like the child laughs and interacts with you, the child bounces back when they experience a setback, and a handful of other items that we pulled from the National Survey of Children's Health. And we saw a big change in the proportion of littles, toddlers, and infants. About 2 and 3 were flourishing, whereas when we looked at elementary age children, only 1 in 3 elementary age children had parents who reported that they had these qualities that were defined as flourishing. So that's a big change. And we wondered what's going on that kids are starting off in a more thriving way when they are little, and yet they are not necessarily continuing to thrive in elementary school. Looks like Erin has chimed in. That's telling me school may benefit from listening to parents. They seem to be more successful. I will tell you, Erin, we did we did what we called data dives, and we took some of this data out to community members and asked them what they made of it. And what Erin said in the chat box here is exactly what parents told us. They said that schools were not creating the environments that their children needed to thrive, and that schools needed to listen more to parents and have a more child-centered approach. And that was how parents understood this change. All right, our last example of a data story is from a Best Starts for Kids strategy called Youth and Family Homelessness Prevention. And here we've just got one data point: 94% of former clients of this program are still stably housed. And we have a story that this family generously shared about what that meant to them. So it's just taking the data and showing how is this actually showing up in somebody's real life. I'll take a moment to let you read the story, but I think it's very powerful, and it, 94%, it sounds great. If I look at that, I would say, oh yeah, that sounds good. But when you see what that actually means for families' lives, it has a much bigger impact, at least for me. So I'll take a moment, we can just read through that. And in this kind of story, it's definitely really important to think about the values that Mariko shared and some of those equity storytelling values, where when we are going to focus on a person's story, that they are able to participate in telling it the way that they would like to see it told. All right, so that has been, again, just a framework to provide some starting points of, if you have data, some different ways to look for stories that it might be telling you. So we are going to break into small groups. We're going to start again with just a couple minutes of looking at some data together so that we can all kind of see what it's saying. And then Hani is going to put us into Zoom rooms. And we are going to ask you, looking at that data, what story might you tell with it? Which data point or data points might you use? And what else would you add? So feel free to be creative. If you're in a group and you have some data that you would like to share that's not the data that we're going to talk about, that's totally fine. You can use your own data or different data that's more interesting to you. But we wanted to give everybody a starting point here. And feel free to use your imagination. So maybe you don't have certain things that you would add, but you could say, I would add this kind of image or this kind of quote if I could get it, or something like that. So feel free to make things up that you might have in a different situation. So that's kind of what we're gonna do. Mariko has put the instructions in the chat box so that when you have them, when we're in the Zoom room, you'll still have them. So I'm gonna take a minute. I think I need to stop my share briefly so that I can go ahead and pull up the website and we can look at this data together. So what we are looking at here is information about food assistance in King County. And we actually, I think just today, we have a report that shows how food insecurity and food needs have changed since COVID. So let me get my screen share going again, and we can look at that data. Okay, so this is some information that the health department's putting together, again, about just outside from people actually getting COVID and some of the healthcare impacts, what are the economic and social impacts? And we're looking at changes in households that have received basic food assistance in King County. This is also called SNAP. So looking at the data right here, feel free to open up this link in your own laptop if you would like to poke around and highlight certain zip codes, look at numbers versus percent, if you want to look at changes over time with the slider. feel free to do all of that. You can also look at some other items related to not having enough food and different demographics in addition to just geographies. But what we're all looking at here on my screen, if you're on my screen, is a map that shows what percent of households are on basic food. And if you hover over, you'll get some more details. So this is looking at zip code. I'm just hovering over a random zip code in kind of the northeast part of King County. And it looks like less than 5% of households up here are receiving SNAP benefits in July of this month, so just last month. On the other hand, I'm looking at a zip code in Southeast King County, and it looks like over a third, over 35% of households in this zip code are receiving basic food benefits. So you can find some more information, hover over a zip code that might be of interest to you. You can find your own zip code on there. You can type in your zip code. So like if I type in a zip code here, I can more easily see how it's highlighted right here. And then down here, in addition to the geographic information, we have the changes over time. So starting in January of 2019 and going through July of 2020, when I look at this, I see there was like a very slight but steady decline in the percent of households that receive these food benefits from last January on through February of this month. And since then, it's really started to go up. And I see that it went up from February through June of this year, and it went down again a little bit in July. So that's kind of an introduction to the data. Before we go into the breakout rooms, I would love to hear if there's anything else that Honey or Mariko you would like to add, and also just questions about how to look at this or how to navigate this from anybody in the webinar before we jump into the activity.
I thought you reviewed it really well, Sarah Jane. Just for folks to know that this is a tool that you can use in the future. It's, of course, we're going to look at it now, but also encourage you all, as Sarah J said, to use data that you might be interested in either having others look at or share a workshop with you too. So it's really up to you all. But yeah, this is a data resource that we put together here at King County Public Health, but we encourage you to find and think through some other data that is important to your programs and communities too.
Any questions about the activity before we break out into Zoom rooms? Honey, Mariko, and I will pop around between different Zoom rooms as you're in groups just to see how it's going. And we're at 2:45 now already, so I think we'll give maybe, what do you think, Mariko and Honey, 7 or 8 minutes before we come back so we have some time to share with the broader group?
Yeah, we'll do 8 minutes, and then at the 8-minute mark, we'll come back into our larger group and just wrap up the workshop.
Great, so if you have any questions, you can reach us by chat while you're in your small group, and we'll try to pop into them to see how it's going as well.
One second while I get everyone into their breakout room.
All right. Thanks, everybody. We have just a few more minutes, so I want to welcome anybody who would like to share about your discussion, whether it's a story that you came up with or maybe just further questions that it raised for you. Feel free to chime into the chat or to unmute yourself.
This is Memory Gladstone. Can you hear me?
Yes, and I'm just going to leave because I know some people might be heading out.
Hello?
So
Hi, we can hear you.
yeah, I'm going to leave some resources up here as well, just in case anybody wants to grab those while we wrap up our discussion. Thanks, Memory. Yeah, let us know what you
Hi.
talked about.
Okay, so one of the things that I thought was interesting, so we were looking through in the rise of the SNAP benefits, and then also the benefits of having the children that are not receiving the free and reduced meals to have accessibility to the SNAP. But then we were also looking at the reasons not enough food. So there are still demographics towards from April to June that still did not have enough food for the last 7 days of the month. And then, you know, that was interesting to me based off of all the resources that are available and like the local food boxes that are being given away, and looking at that, there's still a fear factor. So it looks like from like June 4th through the 9th was like the high point, and then it started decreasing towards the middle of June, and then it spiked again at the end of June. And that was just the afraid to go out to buy food or to get food. And so the fear factor is still eliminating people from utilizing the resources. And then there was still a high quantity of people who couldn't afford it, and also those that they didn't have the food that they wanted in the stores available in stock. So we didn't get to wrap up any of the information. We were just looking through that. But that's part of the discussion that we had.
Yeah, I think it's really cool how you looked into some of the other demographic data and other information about why people were having trouble getting food. Yeah, thank you for sharing. Oh, and I was reminded by Carrie to share one more time, in case anybody didn't capture it the first time, that our code word for this session is radio. Would anybody else like to share either some of the conversation you had in your small groups, or just any kind of closing questions or thoughts that are coming up for you? Well, we really appreciate everybody's participation today. It was great to see and hear from so many of our partners. Mariko, can we drop in our feedback survey? As we do a lot of capacity building around data and evaluation, we also try to evaluate ourselves. And we would really value any feedback that you are able to just take a moment to share with us on this quick little survey. So please let us know what you thought. Please be honest. We love constructive feedback. It helps us make these workshops better. So thank you everybody so much for joining us today. Let us know how it went for you in the survey. We would love to hear from you if you have questions about accessing or finding data. And I also want to make sure everybody knows that if you want some in-depth support with something, if you are a Best Arts for Kids partner, we can match you with a consultant that can help you with Best Arts reporting, or if it's just general questions or wanting some support around building a culture of finding and using data in your organization, we would love to connect you and provide some of that capacity building. That's something that Best Arts for Kids will cover for any of our partners. And I manage that. We have really awesome consultants. They're really, really well versed in taking an equity approach to their data work and meeting community-based organizations where you are, wherever you are. If you are like, I have a bunch of spreadsheets and I don't know what to do with them all, they can help you with that. If you have a great data system and just feel like you're not using it as well as you could be, they can help you with that. If you have a desire to like engage your staff in more data, they can help with that. So Janet, awesome. Let's connect afterwards and get you hooked up. There's also some capacity building funding available right now for Best Starts for Kids partners. You can find out about that on the Best Starts blog. But you can apply for up to just under $10,000 if you need to buy a data system. If you want to get consultation that's not available through Best Starts for Kids, if you need new IT equipment, really kind of anything. So check that out as well if you're looking for a little bit more capacity building support. And we really would love to hear from you at Communities Count. We'd love to see you in future workshops. You can check them all out on our website. Honey, Mariko, closing thoughts, comments?
No, just thank everyone. Thank you everyone for joining us today. We really appreciate it. We have some of our, I think in the next slide, we have some information around just contact information. If you do have any specific questions, again, our website, I think it's the next slide. Yeah, upcoming workshops in 2020. We do have we'll be providing this workshop again a little later in August, I believe next week. Cannot believe next week is almost the last week of August. And then we'll be providing a community needs assessment workshop in September. So please stay tuned for that. And yeah, just thank you all for your time. I know time is very valuable, especially nowadays. So just appreciate you all for joining us this afternoon.
Yeah, thank you so much. I've really appreciated the thought and knowledge and the sharing today. I think that I heard some really, really great insights, and I'm looking forward to seeing more people in our community feeling empowered to start framing the story and telling it from their community's perspective. And so we've provided some tools and frameworks today, but we all know that you all closest to the work know the stories best, and data and storytelling together, I think, can really convey some powerful messages. So also keep in touch. It was also nice to see some familiar faces in the room today as well. So yeah, stay in touch. You can come find us at Communities Count. We have also some technical assistance services available there that you can find more information about. And then the BSK consultants are a really great resource too. So thank you for today.
Great. Bye. Thanks, everybody.